So have you always wondered about dermal fillers, what they are, what they do, which ones? Which one do I pick? How long does it last? How much does it cost? Well, today is the day. I'm here to talk about it all. Hi guys, I'm Patia Johnson, the nurse practitioner and owner of Glow and Sparkle Aesthetics and Medical Spa. And today it's all about dermal fillers and the questions that I get most often from clients that come into my door. So first, what are dermal fillers? So dermal fillers are a substance, it's like a gel-like substance that you can put beneath the skin, underneath the skin, or down directly to bone to help fill in areas that are hollow. For instance, the cheek, as we age, starts getting really hollow. Underneath the eyes, we can start seeing that hollowness there. Sometimes people love to put some filler to help contour areas like the chin, along the jawline there too. And of course, we have the wrinkles here. The nasolabial folds and the marionette lines are common places for filler. So we talked about locations. What are the different types of fillers? People always ask. So I like to keep different pamphlets in the office, and there's this little compact that I have to almost where you can press and feel the different fillers. So a lot of people don't know that there's all different types. So there's very soft fillers, and those fillers that will go more into the lip, above the lip lines, those vertical lip lines or the smoker lines. And then right underneath the eyes is where you want to kind of put that softer filler. Then there are more harder and firm fillers, and people always, ooh, that feels a little bit harder, firmer. So where you want to put those products that are firm is down onto bone, into the cheek area to kind of sculpt that area, give it more volume here. In the jawline to help contour. Everybody wants that contour look and be snatched right there. Into the chin. A lot of people sometimes have something called retrognathia, where the chin actually sits back a little bit. And if you can bring that chin out a little bit, it helps to contour the face as well. Then you have the fillers that are, okay, they're not soft and they're not super hard, but they're kind of in between. So those are where you would put in the wrinkles, okay? So around the nasolabial folds and the marionette lines, okay? So the brands that are most common in the USA that are approved by the FDA, first is Juvederm. Juvederm has a wonderful portfolio of different fillers. We do use Juvederm at the office. So you have different things like Juvederm Ultra, Ultra Plus. You have Volbella that is very soft that you see in the lips, above the lip lines, underneath the eyes. You have Voluma that goes down into the cheek that gives you great results, excuse me. Then Restylane, we also do carry Restylane at the office. That has a beautiful line as well. You have the contour, you have the define, you have the refine, and of course Restylane Kiss, which is known all over the world for lips, beautiful luscious lips. Revenus Versa is also a great line. I love that line as well. We carry that line as well. They have Revenus Versa and then Revenus Versa Lips. The one, just like it says for the lips, goes right to the lips. It is a little bit more of a firmer product, so it is going to give you more volume, okay? The Revenus Versa Regular, more for like the marionette lines, nasolabial folds. Now, when we talk about lips, that is like our number one seller for lip filler or for dermal fillers. So again, you could do something soft. If it's more of a softer product, it's going to give you more of a natural kind of lip, more define that border. But if the product is harder, it's going to give you a luscious lip. And I say, hey, what do you want to look like today? Do you want to look natural? Or do you want to look like you got your lips done? Okay. If you tell me, hey, I want to walk out and I want people to know you got your lips done. Okay. We're going to go a little bit thicker. So that's for that. And then other than those, there are other fillers that either are semi-permanent, so something like Radi S that is going to stay into the skin longer than what a hyaluronic acid filler would do, and those are great too. Those are collagen building as well. And then another one that is collagen building is a collagen stimulator, they call it, that helps build collagen into the skin, help with the structure. It's beautiful around the jawline. Over here in the cheek area as well is something called Sculptra. Sculptra is beautiful. I love anything that can help build collagen as well. Now, you might not see the results as soon as you would for maybe like a hyaluronic acid filler or a semi-permanent filler, but you have to build upon something that's gonna be a biostimulator. So I love, 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 love those as well. So another question is cost. How much do they cost? So fillers, depending on, sometimes people get a half syringe, and mostly I only do half syringes right in the lips unless somebody has some lines, superficial lines they want treated. But a half syringe, if I was to do to the lips, it could be maybe about $450, $350, $550, $650, depending on where you are, okay, location, and of course, expertise. A full syringe, depending again where you are, technique that's used, product is used, anywhere from $650, $950 to $1,000. Here at our office at Glow and Sparkle, we do use ultrasound therapy, ultrasound guidance. So we make sure that we place the filler in the correct area where it's supposed to go. Not only does it give you better results because it's in the correct spot, but you get to use less filler because we know exactly where we're going. That way, instead of having to use 3 syringes, maybe we only have to use 1 syringe because we know exactly where we want to go. So I highly recommend that. Pain, not too much pain. We numb the skin before we do an entry. You could do needle or cannula. Of course, cannula is a little bit longer than the needle. It's blunt at the end, so it's a lot safer than needle. But sometimes a lot of people do both techniques to get your desired results. Ultimately, we like to look at people during their consultation, decide what is the best choice for you. What are your goals? What do you want to see? How can we make you better inside and out? So thank you so much for listening to my talk on dermal fillers. Make sure to follow us on YouTube, Instagram, Facebook, and TikTok. And don't forget to like, share, comment on this video. You guys, thank you for tuning in. Love you. Take care.